And while we're all hunkered down riding out the pandemic, Oregon went ahead and made a massive decision on that $700 billion I-5 expansion project. And if you took all the people who filed for unemployment this week and you lined them up at a socially distant 6 feet away from each other, how long do you think that line would be? Reuters actually did the math on it, and it's insane. Here's the story.
Hey there, folks. I'm Dan Haggerty, and this is the story all about how our life got turned upside down. So what more can we do except talk about it? Reach out, give us your questions, your thoughts, your concerns, your critiques, whatever you got. Get on Twitter, use the hashtag HeyDan. We check it throughout the show. Or use email, Instagram, Facebook, any of your favorite and now only social outlets. And I want to kick things off with something I think is good news tonight. I think it's really good news, actually. The folks studying the spread of COVID-19 in Oregon say, with all of the action that we've taken to flatten the curve, that we may have actually stopped the spread by half. And Oregon hospitals should be equipped to handle the number of cases that they project. But, there's always a but, right? Things are a little different in Marion County. It's a hot spot for this virus. There are 164 cases there, more than Multnomah County, despite having less than half of the population. The mayor of Salem points out that Marion County is sprawling and it touches a lot of rural communities, and Salem Health services all of them, meaning that everybody who needs health care, they have to funnel into one place, possibly contributing to the spread. But on the opposite end of the spectrum, you have Coos County, which has 0 cases right now. Doctors there say they're so isolated from the rest of the state that they haven't seen any surges like we've seen in urban areas. But that could also prove to be a problem if things change.
It can make it harder to get resources and transfer patients out if that's something that we need to do.
Now, they already know that they don't have enough PPE and only 9 ventilators, so they're already trying to conserve. It's also worth mentioning that you can't have coronavirus and not have symptoms, all right? That's widely known. So without widespread testing, there is really no way to know exactly how many cases are in a particular county or city or even in your home. All right, let's talk about our big story tonight. We're actually going to zero in on one of those confirmed cases in Marion County because the person who tested positive works at the Oregon State Penitentiary, a maximum security prison in Salem where thousands of men eat and sleep and live in close quarters and do that around the clock. Now, if your COVID-19 socially distant alarm bells are going off, you're not alone. And that brings us to our quote of the day from Alice Lundell of the Oregon Justice Resource Center. She says, quote, "Prisons and jails can be death traps when a disease such as COVID-19 breaks out." Now, her group wants the state to do more to protect people in prison and prison employees, so take that quote in context. Tonight, we wanted to know, though, what is stopping a global pandemic from ravaging Oregon's prisons, especially with now an employee testing positive. Maggie Vespa went to find some answers.
We'll start with the employee who tested positive for COVID-19. To be blunt, we don't know a lot about them. The Oregon Department of Corrections only telling reporters that person works at the Oregon State Penitentiary in Salem and had contact with some of the more than 2,000 men incarcerated there. The news announced Wednesday. It set off a chain reaction.
We are going cell by cell, person by person, bunk by bunk, and asking them the CDC-approved questionnaire and taking their temperatures.
In a rare interview, the DOC's chief of medicine, Dr. Christopher DiGiulio, told us that field study went well. He says as of right now, nobody who came in contact with the employee is showing symptoms. We've also learned the DOC has tested 13 people in Oregon's prisons for COVID-19. All 13 tests were negative.
But I want the people of Oregon that have loved ones inside of our institution to know that we're working around the clock and we're doing everything we possibly can to maintain their safety and health.
Tangibly, he says the DOC has closed facilities to all visitors, including contract employees, something they've never done before. They've eliminated all group activities and laid markers on the floor to help everyone stay 6 feet apart. They've also educated people there about proper hygiene, and they've set up quarantine areas in every prison in case an incarcerated person tests positive. All that said, Oregon's prisons contain close to 14,500 people, and they're run by more than 4,500 employees, many of whom can't work from home. So it begs a blunt question. And a note, AIC stands for Adult in Custody.
Is there enough space, though, for those people to remain 6 feet apart?
We are doing our very best to educate our AICs and our security staff on the importance of social distancing.
Is that a no?
The answer to that is we're doing our very best. And again, with 14 different institutions, with multiple line movements, people have to go get their medications 3 times a day. They have to go to chow 3 times a day, which is to eat their meal 3 times a day.
Those realities in mind, KGW this week received multiple statements like this one, which started by calling these facilities death traps when a disease such as COVID-19 breaks out. It came from Alice Lundell at the Oregon Justice Resource Center.
If there is a one message, what would you say that was?
Release people.
That plea aimed at Governor Kate Brown. The OJRC is calling on her to commute prison sentences of the elderly, the immunocompromised, people with release dates already set for this year or next, and people whom DOC staff believe can safely return to society. They argue bringing the prison population down would let people on the inside keep their social distance and in turn protect people on the outside.
Because we know that if there is an outbreak, it's not likely to stay in the prison. We still have people coming into and out of prison. We have staff coming in and out. So an outbreak in a prison is likely to spread.
Okay, Maggie Vespa joining us now. Maggie, you actually just heard back from the governor a short time ago.
Yeah, Dan, that's right. Her office sent us an email basically saying that she's heard what these groups are asking her to do and she is considering it. She just hasn't made a decision yet, but she'll keep, they say, sort of consulting with health experts and the DOC on this.
I was thinking this has to be especially interesting for you. For people at home that don't know, you were part of a team here at KGW who spent a year covering women inside Coffee Creek Prison for a series on the Life program, and we just aired that a couple of months ago.
Yeah, it's insane, you know, to think about that program. And we were there for so long. It seems like it was both just yesterday and then also like an eternity ago compared to how we were then living our lives and how we're living our lives now. I want to show you a video just to kind of refresh everybody's memory. Again, this is of the Coffee Creek Life program, which teaches women about to leave prison to build small business plans. Obviously, now that program is on hold. It's run by Mercy Corps Northwest, and the coordinator, Epi Bustamante, is also calling on the governor to make prisons safer amid all this, in part by reducing the population. But that's not all. Take a listen.
We're also asking that all communications are free during this time that visitation is suspended. I can't even imagine not being able to communicate freely with folks that I love, to hear about the status of my communities and my children and my parents.
So to Effie's point, I left a voicemail for Mariah Williams, the only woman from our pieces from our series who is still in prison at Coffee Creek. And I asked in that voicemail if she wanted to talk to us about this, about watching this pandemic play out from inside prison. She's close to her family. I mean, they live here in Portland. She talked about them a lot. So kind of speaking to Effie's point, to leave that message, I had to pay $1.25, and then people in prison have to pay to call anyone on the outside as well. So now we're hearing calls from Effie at Mercy Corps Northwest to make those communications free, among other things, while we all sort of progress through this pandemic and while all that is going on in our prison system. Dan, we have so much more on this story, per usual, at kgw.com if people want to check it out.
You got it, Maggie Vespa. Thank you. Now, unemployment claims in the U.S. just broke another record. More than 6.5 million people filed claims last week. Now, it's actually kind of difficult to wrap your head around just how big that number actually is. So here it is put another way. Reuters put out this chart. Now, if you imagine everyone who filed for unemployment in the last 2 weeks standing in a line 6 feet apart from each other, that line would stretch more than 11,000 miles. Oregon's numbers jumped by 21% last week. Nearly 93,000 people filed for unemployment. So the wait for those government stimulus checks is feeling a little longer every single day. And real quick, I kind of wanted to clear something up, some confusion now that some seniors on Social Security had about getting those checks, because we've had a lot of questions about it. Steve wrote me and said, "Hey, Dan," in an email, I receive monthly Social Security benefits. I do not receive enough to file a tax return. Will I be eligible for a stimulus check. Now, look, I'm not surprised a lot of people are confused by this because the government has kind of gone back and forth with their answer. Earlier this week, the Fed said people on Social Security had to file a tax return to get that money. But last night they said, never mind. Now you don't have to do anything if you're on Social Security. The government will just use the information on your 1099 Social Security documents to send you that money. By the way, the IRS is going to start sending those direct deposits out by April 9th. But there is some bad news here. If you're expecting to get an actual check and they don't have that direct deposit going into your account, you may have to wait until September to see it. Now, it might feel like the world has stopped turning entirely, but people in power are still making decisions that will impact all of what we do here. Finally, it's finally safe to hang out with each other again eventually. And right now, I will say a big one was made today during a remote meeting of the Oregon Transportation Commission. That super controversial I-5 expansion at the Rose Quarter was unanimously approved today to move forward without another lengthy environmental review. Now, if you're not familiar, it's a $715 million plan. I think off the top of the show, we ran that little open and I said billion. That would be a really nice freeway. This one's only a $750 million plan, not billion. But the plan is to add merging lanes on both sides of I-5 between 405 and 84, basically right next to the Moda Center. It's one of the worst bottlenecks in America, and ODOT says that the plan will reduce crashes. But groups like No More Freeways say the state should encourage alternative forms of transportation instead of adopting the plan that could encourage more people to get in cars and drive around. Now, other environmental groups urge the state to hit pause and do a longer environmental study on the impacts. But the commission said, no. They don't want to wait for that. Aside from the environmental impact, another key point of tension is the freeway's impact on the Albina neighborhood, which was basically cut in half when I-5 was built there in the 60s. The commission hopes that the expansion will also heal some of those wounds.
The project will also seek to connect the community that was displaced from their homes and their cultural center by the construction of I-5. The Albina neighborhood, which was the heart of Oregon's African American community. At your direction, the project will be intentional on how these values committed will result in restorative justice outcomes.
They expect to be finished with the construction in about 7 years.
This Rose Quarter expansion has been a long time coming, but how did we get here? Really, we have to start in 1962, when I-5 carved its way up through Oregon and through the lower Albina neighborhood. That on top of the building of the Memorial Coliseum, Emmanuel Hospital, and the Albina Community Plan in 1993, hundreds of African American families were effectively kicked out of their homes. Fast forward decades to 2017, when the Oregon legislature passed a $5.3 billion bill to pay for transportation projects. It raised taxes on things like gas and income and car sales to pay for projects that reduced congestion throughout the state. Governor Brown called it one of her biggest priorities, and the I-5 expansion was one of the crown jewels. Over the years, it's been a hot topic every time it comes up in community meetings, with dozens of environmental, transportation, and social justice advocates coming out to speak their mind. In January, several Portland politicians indicated they would oppose the plan unless there was a more extensive environmental review and justice for the Albina neighborhood. But on March 27th, they appeared to back off from their environmental demands, which leads us to today, when the Oregon Transportation Committee said the project can move forward without a lengthy environmental review. And that's how we got here. Gas prices have dropped to below $2 a gallon on average. So why are we still paying $3? And we're adding to the list of pre-approved places to cough. Into a tissue, into your arm, and now into your phone? And you probably saw some advice go viral on social media recommending that you don't buy groceries on the first of the month, to leave enough stuff for WIC recipients. And as good-hearted as that is, it's actually not necessary, as long as you don't do one other thing. When the story continues.
Time to answer some viewer questions. So this person wants to know, hey Dan, since we are doing all this cleaning, is there a place we can drop off items to a Goodwill or other location? Thank you, Cindy, for that question. No, I know a lot of people are doing tons of cleaning right now, and they probably have a bunch of stuff to donate. I think we have a pile in our garage, but Goodwill is not accepting items at this time, so just hang on to that stuff. Do a deep cleaning, and then later on, you can donate those items. All right, please keep sending in those questions using the hashtag HeyDan. Okay, now for a question we've been getting day after day. This person wants to know, hey Dan, what responsibility do stores have to inform the community when they have an employee who is infected? All right, we've checked with several agencies on this, from OSHA to the governor's office. Right now, it looks like there's no legal requirement to tell your customers about a COVID-19 diagnosis. Again, we're talking about legal, not moral or ethical. But if we get any more information on this answer, we'll update you. Please keep sending in those questions using the hashtag HeyDan.
All right, Kristen, thank you. Hey, by the way, instead of forcing you to sit in front of your TV at a predetermined time like it's 1985 or something, we put all Kristen's Q&A segments into a YouTube playlist for you. It's real easy. Just head to the KGW channel, look for the Coronavirus Q&A playlist. We've also devoted a portion of our website to answering questions. That's kgw.com/answers. You can also watch every episode of the story on YouTube, by the way, too. Binge us if you want. We answer questions, too, using the hashtag Hey Dan, like this one we got from Jimothy McTiernan. How about that name? First of all, Jimothy, that name rules. And then McTiernan, I wonder if he's related to the guy who directed Die Hard and The Predator, which are like two of the greatest movies of all time. Look, I digress. Jimothy asks, I just got a summons by Multnomah County Circuit Court for jury duty in May. Do you have any information on whether the courts will be open then? Well, we took this to the courthouse for some answers, and they said that they aren't doing any criminal trials right now, not at this time. But grand juries are still being assembled. As for regular juries, a court spokesperson told us this, saying, we have asked jurors to not come to the courthouse for the past 2 weeks, but it is possible that jurors might be required to come into court later in April and in May. So jurors should not assume that their jury service is postponed. Look, best practice here is if you're summoned, check out the court's website. There's also a number on there that you should call the night before to see if you are actually supposed to report, to see if you really do need to be there. Now, you may have seen headlines like this in the past few days. U.S. gasoline prices are below $2 per gallon on average for the first time in 4 years. Well, it makes sense since a lot of people have stopped commuting. They're staying home. They're buying less gas. That's how that works. But if you've gotten gas recently in Oregon, you're probably thinking, less than $2 a gallon, huh? Well, what gas station's offering that? Because it doesn't seem to be happening here. And you're right, it's not. Here's a map showing gas prices across the country. Those blue and purple areas, that's where you're finding it for under $2. But out here on the West Coast, it's much more than that. In fact, if we break it down by county in Oregon, the average price for each county is more than $2.30 a gallon. And in the Portland area, that average jumps as high as nearly $3. But that doesn't mean that gas prices are not going down here. The blue line on this chart is the national average, and the red line is Portland's average. We've pretty much mirrored the price trends over the past 6 months, including the latest drop. We just started at a much higher price than the rest of the country, so we're still paying a lot more. Gas is more expensive in Oregon because we don't have any petroleum refineries here. So all the gas that we have has to be shipped in from other states, and those transportation costs can add up.
Hey everybody, I'm Matt Safino, and in the weather story tonight, we're going to talk about something we talked about, last week, I believe, the decrease in the number of weather observations, weather data that we're getting from commercial aircraft because there's been such a sharp decrease in the number of commercial flights that are going on out there. Here's a graph that actually illustrates that. This is from the WMO, the World Meteorological Organization, and you can see how steeply the decline is with all these airlines. This black one here, that's Lufthansa, seeing a really sharp drop. The yellow one, or the orange one, is a European airline called EasyJet, also seeing just an incredible drop down to less than 2,000 flights per day. That's really amazing. Well, you know what? It's not just the drop in aircraft weather data that we're seeing. We're also now concerned about a decrease in the number of surface observations. Now, what you're looking at right now is the entire fleet of weather observations that we rely on to run our weather models and to monitor the climate and weather around the world. Of course, we have satellites, we have radar, we have international aircraft, we have ship observations, we have buoys, we have drifting buoys. But I want to focus on the one that's in the bottom of your screen. I'll zoom in on that for you a little bit. And those are just regular old meteorological observation stations that humans take. Now, many of them, most of them in our country are all automated, but in some countries around the world, they are not. They are still done by human measures, and we're seeing a decrease. In fact, we're not getting any data out of some countries like Ecuador right now. So that's a concern as we go forward, as we see less and less weather observations coming out. We'll see a decrease in our weather monitoring, our climate record, but more importantly, the weather modeling may suffer a bit because all of those observations go into the modeling. So again, another thing that we're concerned about as this coronavirus drags on, people aren't able to go and repair systems, re-implement systems, stuff like that. So again, it's just another impact that the coronavirus is having on not only our day-to-day lives, but our lives going forward. Dan?
I know a lot of people are thinking, well, way down in Ecuador or somewhere else, but it's all connected, I'm sure, right? I mean, each kind of section of the world tells you what's going to happen next.
It's a global system.
Yeah. All right, Matt, thank you. That's so interesting. I would have never thought of that.
That's
Appreciate
right.
it. All right, so here's something else that we found kind of interesting. Researchers at the University of Washington are making an app for healthcare workers to monitor the coughs of coronavirus patients. But they're not done with it yet, and they actually want your help. And by that, they mean they want to hear your cough. Sounds a little weird, but it helps them out. See, the app has to be trained to recognize coughing sounds. So they want volunteers to record the sound of their cough and then send it to them. Even if you're healthy, you don't have to be sick or anything, they still want to hear what your cough sounds like so that they can then compare that to patients. You just fill out the survey and the consent form, and then you can record your coughs right there from the computer. If this is something you're interested in, we put a link for you if you want to help out. Hey, thanks to everyone sending in your questions. Kristen has got a couple more answers for you coming up. In the meantime, we're going to read some of your comments after the break. Plus, you might have heard it's best not to shop for the first few days of the month, to leave enough stuff for the WIC recipients. But we're going to offer an alternative plan when the story continues.
All right, this person wants to know, hey Dan, what is the best way to clean things like your car steering wheel, glasses, and purse? I tried to use Purell on the steering wheel and the black started to come off. Definitely not the best idea. This is from Lynn. Lynn, thank you so much for that question. This is a great one. So according to Consumer Reports, they say you can use a cleaning solution that contains at least 70% alcohol for the inside of your car. Don't use bleach or hydrogen peroxide on your car on the inside. For glasses, you want to use screen wipes, and for leather bags, you want to use disinfectant wipes. Please keep sending in those questions using the hashtag #. Okay, this person wants to know, hey Dan, if some people are just carriers of coronavirus and are asymptomatic, how long are they able to pass it on to other people? We just don't know, which is why doctors say we have to comply with the isolation orders. Not only are there infectious asymptomatic cases out there, but there's also evidence that people who have recovered from the illness can still transmit the virus. This virus hasn't been around long enough for us to know how it behaves, so we just have to be extra careful and stay home. Please keep sending in those questions. We do our very best to answer them. Use the hashtag #HeyDan.
All right, Kristen, thank you. Hey, here's something that we really think is worth your time. It's an article from the Oregonian clearing up some of the social media posts that's been floating around. There have been a ton of posts saying that people should hold off on grocery shopping right now because low-income people get benefits at the first of the month, and this will make sure that the stores are stocked for them. And while it's a great sentiment, that's not exactly completely true. WIC recipients do get money at the first of the month, but SNAP benefits, they can come more than a week or so later, and Social Security benefits are spread out throughout the month, so depending on birth dates and stuff like that. So again, great intentions there, but holding off on shopping won't really do that much. What you should do instead is do what you should always be doing, and that's not hoard anything, but only get what you need to get. Pretty simple, actually. Hey, I want to read a couple of comments. One person writing in saying, hey, Dan, why are liquor stores still open when all the non-essential services are supposed to be closed? I don't know the exact answer for that, but I know that liquor stores are open. I know pot shops are open. I know a lot of things that maybe individual people might not find to be essential are open, but you know, as long as they're practicing safe social distancing, there you have it. And then some people were wondering, they said, hey, Dan, in the opening of the show, were you borrowing a couple of lines from the Fresh Prince of Bel-Air theme song? No, I wrote that. I don't know what you're talking about. That's it. That's the end of the story. Yo, home. Smell you later.